And we are back on the same spot. Liza tried to go after the doggo. So, and also 2 days ago, and one of the in December, two of the local healthcare centers here in Ljubljana were actually shut down due to the lack of employees. So a lot of the doctors and nurses and other staff were on sick leave due to the rise of cases of COVID and regular respiratory infections. So they decided to just close down, according to them temporarily, of course, two of these healthcare centers, and just redirect all the patients that were previously, declared in that healthcare center to another one. And then, of course, our mayor still fully supports the Tukilizi, fully supports the director of the whole local healthcare center here in Ljubljana. So officially it's a Ljubljana Healthcare Center, but it has several, districts. So we have, Ljubljana Šiška, Ljubljana Šentvid, and so forth. Ljubljana Center, Lizi Greva. And then, of course, media last year also reported that the director, so she is a trained doctor, physician. She isn't employed, well, she's employed as a director, but she also has 20% supplementary permission to work as a physician in her own private practice. So she doesn't work that 20 hours, 20% of her time that she needs to keep her license, medical license. Lizika, we cannot go there. Okay, greva pa tam. Ne greva nazaj. She wants greva tuki. Okay, I don't know where we will come, but as you can see, she has a lot of opinions where we should walk. Okay, we have never walked around here, in the middle of the zone. So they then last year in December they shut down those two local healthcare centers, two divisions, and then 2 days ago our Ministry of Health told to media that our mayor is now planning to permanently shut down these two locations, local health centers, Lizika, because they are in such a great location, so that most likely they will be torn down and build some more, apartment buildings or even complexes, and people still vote and support this mayor. We have in last, everything is building. Yeah, that's fine, that's great, Liza. But if you are, in all this time that you are building new apartment complexes with several hundred apartments, and at the same time you don't put any money into the, let's say, critical infrastructure, including healthcare center. So in the last 20 years, just here in Shishka, I would say they have built 10 complexes or large buildings or whatever, with several more thousand people coming here to live here. But in the meantime, they didn't invest any money. Well, I have to correct myself. Several 10, I don't know how many years ago, our local healthcare center was modernized. Tuki greva. Tuki naravnost hodva, Lizi. We'll try to. I don't want to walk there. It was modernized primarily with the EU funds, but if you have just new, good-looking offices, doesn't mean that you have improved the healthcare center if in the meantime the number of the doctors, dentists and everything else is just falling. And yeah, this is one of the problems of let's say centralization. Everyone is living smaller places, countryside and so forth. Everyone wants to live in the city because of course the infrastructure is better, but when people do not consider the long-term effect of this flight to the city, it will cause problems like we are currently facing. And of course they have started, several years ago. The second faculty of medicine was opened in Slovenia, so now we have two. Now we have also 2 or 3 healthcare faculties, so for nurses and technicians, and they have also started trying to recruit doctors from other countries, primarily from ex-Yugoslavia, and of course some also came from Eastern Europe. But yeah, the problem is our healthcare system still is not designed in such a way that would cope with the number of people that need health care, due to the fact that it's still based on the socialism system and not on the social. And there is a big difference, So a lot, and of course, this is the most, let's say, I will continue this, or I will end on this and continue later.